So we are back to the next session on bodies in crisis. What is the heart of the matter? Don't forget, you and I are on a journey. We are forensic. We are like forensic scientists who are trying to decipher what is the underlying causes of the symptoms in a human body. So at this stage, we encountered our prospective patient. This person has got complaints of unwellness. We're going to be using the obvious to establish a firm basis for further investigation. So let me just put it in plain language. As I said in the previous video clip, by now, because of COVID-19, we have all become quite familiar with terms like asymptomatic. We have become very familiar with a lot of just clinical jargons. We've become familiar perhaps with words like fibrosis. We've heard a lot about respiratory distress, and words that would have been out of the realm of common usage for most of us. As a result of this pandemic, we are all now becoming more and more exposed to the use of such language. Now, my topic is our bodies in crisis. Getting to the heart of the matter. And my whole approach to health complaints is to picture myself as a detective who has been informed that there is a crime scene, and I am expected to go and determine what is wrong, what is happening in the crime scene. I mean, that is my that is the pattern. That is a pattern I use for explaining what is wrong with the person. And this subject is clinical assessment. So the topic is my bodies in crisis. Bodies in crisis, I beg your pardon. Getting to the heart of the matter. And this session is part 2 of the clinical assessment part of this topic. Why clinical assessment? Most people, whether they are clinical or non-clinical, would agree that the best starting point of resolving any problem is to do an assessment to determine what is wrong in the first place. Now, in the first video session, I mentioned the importance of being organized. I mentioned the importance of adopting an organized approach to assessment. Now, this doesn't have to be technical. It doesn't have to be something that you have a background for doing usually. All you have to do to begin a good clinical assessment is to take stock of the human person before you, take stock of the individual before you, and size them, assess them from top to toe. And that is where we got to in the first video clip. I was saying that why don't we start from the head? And what I failed to mention after referring to looking at assessing the skin to see whether there is an inflammation, to determine whether the temperature, the skin temperature is normal, is within a normal range. to determine the coloration, I should have highlighted a bit more about the coloration, the skin, the color of the skin, because that is another indicator of health. So when we have blood circulating normally, we know that the skin has a healthy color. We usually say, look, the skin has a healthy color. Now, when somebody looks pale, we tend to think that maybe they are not having enough circulation, or they are very close to a clinical condition called shock. So the color leaves their face, the color returns to their face. It just tells you about the circulation of blood. Okay, so that is one way we can determine health. And in most cases, before somebody goes into shock, one of the things you notice is that the color, they develop a pale complexion, very pale, which is outside their norm. Sometimes the coloration, the skin coloration can be jaundiced. They can look jaundiced as well. So these are all indicators of ill health. Now, another thing is you can look at the coloration in the lips, okay? When the lips looks cyanose, sometimes dark bluish, it's also an indication that there is a lack of oxygen, which oxygenated blood, I beg your pardon, oxygenated blood. And so when you're not having enough perfusion, flow of fluids, blood, either because somebody is dehydrated or because for one reason or the other there is some obstruction, then that also is signposted. You can see the color on their lips. So we got to examining the obvious when you're looking at somebody's face, the head. Another thing about the head is that when you're looking at the pupils, so don't forget that it's a gateway. The eye is a gateway to the brain, okay? The eye is the gateway. You can see the brain. So what's happening is that we call something neurological observations, okay? So that is all to do anything to do with the brain, the central nervous system, okay? Starting with the brainstem. So the brain activity, whether someone is having a healthy brain activity, you can recognize it through, primarily, you can recognize it through their response, their pupil responding to sensory stimulation. And one of the ways we assess that is we assess their photosensitivity, their reaction to light or their reaction to moving objects close to them. So the pupil reaction, because that is a spontaneous movement. When I put my hand towards or I introduce a beam of light, my pupils react, because what happens is to introduce that light, to adjust so that you can actually get a good vision. Now, this is spontaneous, and this is one thing that indicates that you have an active brain function, but there are times when that is not, that is outside the norm. The reaction is outside the norm. And if you're in a clinical environment, there are charts for measuring that. Okay, there are charts for measuring pupil reaction. So that is something else that can be assessed. So I'm going to leave the head, the upper part of the head, and then I'm just going to go from the trachea. Okay, I'm just going to do the trachea, this bit, the neck region. So I'm going down now. So at the base, okay, at the base of this opening, the oral pharyngeal pharynx. So we've got the oral, which is the mouth. We've got the pharynx, so nasal. So we are looking And if we have a diagram, I think I've got a diagram to illustrate that. I'm just going to pause this now, and then when I come back, I'm going to be illustrating. Hello, I have some diagrams to illustrate the point I was making. Remember, I was talking about a top-down assessment, top-to-toe assessment. So I was talking to you about, that's the stage I got to. And I just want to make sure that I have captured it well in the camera. So I got to this stage. Then over here, so you have the nasal passage here. And at this stage, at the back of the nasal passage, you have the nasal pharynx, which is the upper part of the throat. So you have the nose, there's an opening, which is the gateway, and it slides from the nose down, and it meets at the back of the throat. So it leads to the back of the throat. And that is why when you are clearing your throat, or you are actually, if you've got a catarrh or a blocked nose, you're taking a deep breath and you draw, and when you draw the phlegm, you are able to pick it at the base of your throat and spit it out, because the nasopharynx, they are connected. Okay? So now we are looking at the base, the upper part of the throat. And before I paused the recording, I actually started talking about the trachea. So I'm going to lift this up here so that you will see moving from the back of the throat, and then you're going right to the, just down, and this part is a trachea. See that part. So how do you see all the part from the neck? This part down there, the trachea. And the trachea, at the very top of this opening, you have the epiglottis. So over here, there somewhere, you have the epiglottis. Now, what is the epiglottis? It is like a flap that can fold back to stop food from entering the windpipe. Because at the top there, you have two passages. One goes to the windpipe and one goes to the digestive tract. Okay, just goes that. So where food passes through. So the epiglottis blocks food. When you are eating, it blocks food from going into the windpipe. Okay, right. Now, obviously, when we are looking at what the subject called basic life support, we will be talking more about the airway. But at this stage, I want to get back to the point I was making about clinical assessment. So basically, in clinical assessment, you have somebody who is complaining of being unwell, and they might be able to identify the part of the body where they are feeling unwell. It might be a localized pain. It could be a pain in a specific part of the body. But because the body is a network of cells, tissues, organs, and systems, because it's a network, more than likely, a condition which is localized, which is in a particular locality of the body, could become linked systemically. It could become linked through the network. And so it's just common sense that when we are doing an assessment, we eliminate, we just check to make sure that this condition, which is presenting in a particular area of the body, or this local condition, We just want to make sure that it is not affecting other areas. Now, another way of looking at it is sometimes you might have a problem which is presenting in a certain area of the body, but it may actually be a symptom of a problem in other parts of the body. So what the person is presenting with might actually be a byproduct of an earlier problem, which is why assessment is important, which is why a thorough assessment, a top-to-toe assessment is important. Now, one of the things I want to mention, because I don't want this clip to be rather long, I want to go to the next phase, which is the fact that our assessment of the obvious is expected to signpost us to the not so obvious. Because sometimes the not so obvious might be something that is critical. So the person might be critically ill, and these obvious things might just be highlighting a bigger problem, a more serious problem. Now, one illustration I was thinking of is, if you go home, you come home, how do you access your home? You access home through the front door. Is that right? Yes. And then the front door would lead to, after the front door, you often have a corridor that leads to the other rooms in the house. Okay, you have an access place. Now, the front door isn't your destination. You hardly have people going home and they just stop at the front door. They always use the front door as an access point to go to the other parts of the room, of the house, okay? And so the assessment we do of the obvious of the body, the same things are just an access. They're just supposed to signpost us to investigate, to be in a better position to investigate what could really be going on. So your body's in crisis, you are presenting with certain symptoms, and you are doing an assessment from the head right down to the feet. So you get to the trachea here. Now, one of the things about the trachea is it's the airway, and that is where our very survival, it affects our very survival. So I won't go into much detail here because I am going to be talking about that under basic life support. But what I would say here is it takes about 3 to 4 minutes to somebody whose airway is obstructed to have a respiratory arrest, to stop breathing, which would precipitate into instant death, because when you stop breathing, oxygenated blood would your brain cells will be starved of oxygenated blood. The vital organs like the heart will be starved of oxygenated blood, and you would be dead, or you would have irreversible damage by the time you are resuscitated. So the point I'm making here is that we are moving from the access point, the entry point, into the areas where if they are obstructed, you would be denied your very life. And so in the beginning, when you are doing all these assessments of an individual, by the time you get to the trachea, by the time you start assessing the airway, you want to make sure one thing. You want to make sure that that airway is not obstructed, that airway is not blocked. So every part of the body, when you assess them, you've got a primary objective, okay? If you are looking at the head, you want to make sure there is no injury affecting the head, because injury affecting the head injury could also mean that your brain functions will be affected. And if your brain functions are affected, then your whole body is lacking the central control system. So your whole body is affected. So that's critical illness. Your brain function is affected, which is why we look out for head injury. So we examine the head to make sure there's no injury, but also because the head is a part of the body, you examine the skin, okay, the external, the things, orifice, the external, the entry points. I will pause this recording and I would say some more. We're going to go past the trachea. We're going to go to the thoracic cavity, the area which contains organs like the lungs and the heart, which is the thoracic cavity, in our next session. I hope you found this useful. And if there's anything that I have rushed through, or if anything that is not clear, feel free to send me some feedback. Thank you.